Hi everybody. This time of year, we have a lot of people coming in and saying they have their kids on antibiotics and they're taking antibiotics and asking if there's a better way, maybe an alternative. And we feel in many cases there is a better way, a better route to take. And we're just going to go through a few things and maybe just the alternatives and what might be the dangers of taking antibiotics and such.
All right. So a lot of times antibiotics are prescribed without really knowing whether the infection is a viral or bacterial thing. So first of all, you want to make sure if they're trying to prescribe antibiotics for you, ask them, is this a viral infection or a bacterial? Because if it's viral, it's not going to do anything anyways.
Right.
So why destroy the gut? We'll talk about that in a second. If it's not going to help the infection anyways.
Right.
On the flip side of that, one of those things that they do prescribe antibiotics for a lot is ear infections for kids or even sinus infections for adults or whatever it may be. But I kind of wanted to go down the trail of what treating symptoms like that does over time, because there are effects to it. At any drug, there's going to be a side effect.
Right.
So when you put an antibiotic in the body, first of all, an antibiotic's not intelligent. It doesn't know for an ear infection I need to just stay in the ear, right? So the antibiotic's going to go through the whole system, and a lot of times it's like setting off a bomb. It kills the bad stuff, which is great, but in the meantime, it's also killing all the good bacteria, especially in the gut.
Yep.
And that's where 80% of the immune system is. So after that infection's gone, that leaves the host kind of prone to more infection. So all of a sudden, they're prone to another ear infection, and that's usually what happens is it comes back.
Right.
And a little bit stronger this time, and maybe it goes to the both ears. And so they prescribe a different antibiotic because they over time become resistant. And then another antibiotic, 4 rounds. I just had a patient, we'll share the video here in the next couple of weeks, of a patient that came in with their child that had been through 4 rounds of antibiotics, and they were still getting ear infections every week.
And see, they never really get to the cause. What caused the weakness in the first place that the kid would get infected? That's the key. But
So, and then once they run out of antibiotics to give, they figure, oh, well, we've got to get the fluid out of the ear, because they know that's part of the problem. So they'll put tubes in the ears. Well, that opens up another avenue for bacteria to get in the body. Well, then if that doesn't work and they keep getting infections, what is the first line of defense for the immune system? Is the adenoids and tonsils.
Yep.
And so those get inflamed and those start flaring up. Well, then we better remove those too, right? So that's the next route that they go, is removing the tonsils and adenoids. And once you remove that first line of defense, now it gets into the respiratory system. And it just keeps going down as we treat effects like that, and we just treat symptoms, and we never really get to the root cause. So talk about the root cause. Why does it start in the first place?
that's a good point. So I want to go back just a little bit. So if you do take antibiotics and it gets into it kills the normal flora, a lot of people now at least are knowing that, oh, I should take some probiotics. And it is an artificial way to get it built back in there. But for every round of antibiotics, it can take up to a year to get that normal flora back in there, even taking probiotics. So it takes a long time. It does a lot of damage. But the cause, that's the key, is if there's any kind of interference with the nervous system that's affecting your immune system, affecting the ears, it just weakens the ear's ability or the body's ability to fight off the infection. And it can be, you add diet into that. They're eating a high sugar diet, and it weakens the immune system. But the cause is a weakened state, a weakened immune system. So if we can do something to improve the state of the individual, improve the strength of their immune system, then they can get over it without all the antibiotics.
And the immune system's one side of it too, but the other side of it, like you talked about, is what's the cause of the issue is we have the fluid in the ears, but why does the fluid not drain? Right? And there's muscles that are controlled by nerves that come from the brain through this part of the neck into the little muscles that control the tube called the eustachian tube that drain the ear of fluid. And if there's interference from a misalignment in the vertebra up there, it compresses the nerve and it doesn't allow signals to get through to tell the ear tube or that eustachian tube to open and drain, so that fluid stays there.
Yeah, and what I'm finding right now, I'm really checking everybody's upper back, middle back, because that has nerve supply to the lungs. And right now we're seeing a lot of respiratory stuff and flu and that kind of thing, respiratory flu. And I'm just trying to make sure everything's clear there, because if there's a weakness there, it weakens the nerves, it weakens the lungs, and they're going to get sick more often. So, yeah.
So I want you guys just to be aware of the different options. A lot of people don't know that chiropractic can boost that immune system. It can help drain the fluid from the ears just by removing interference. But we also want to give you natural options like probiotics, what things in the diet you should stay away from. So this is just our way of getting this information out there because a lot of people just don't know. So we hope this is useful for you guys. Thanks for taking the time to watch.